When we speak about full mouth rehabilitation or the complete dental rehabilitation, nowadays we get to see a lot of people losing all the dentition starting from a very early age of 26 to 28. People tend to lose many of their teeth by the age of 60 and 70, but it could be 30s or 40s. The primary reason may be periodontal diseases that we get to see quite common nowadays. And along with that, the deficiency of vitamin D, which weakens the existing bone, which makes the bone more porous and which makes the bone susceptible for the damage along with the gum infection. And also poor oral hygiene maintenance for some individuals where they tend to lose all the teeth, they get decayed and they get them pulled out. Now with the experience that what I have gained over the period of 13 years, what I have seen is almost close to 500 to 600 full mouth rehabilitations. What I have done with my experience, what I can share to the people is there are multiple factors one needs to consider when you get across such kind of clinical scenario where patients lose all their dentition. It is very imperative for the clinician to be equipped with giving treatment solution or options to the patient. So the traditional method of dentures, of course, at a very young age, it's not comfortable to have dentures. So what are the next alternative is utilize the bone that is there underneath the teeth after the extraction of all those diseased teeth. If possible, place straight implants and then rehabilitate over those implants. Like for example, if you lose around 14 teeth in the lower and 14 teeth in the upper jaw, there is possibility to place straight implants. Around 8 implants you can place in the lower jaw 8 and upper jaw 8, and you can thoroughly rehabilitate placing a straight implants. But this will not be a condition for all the patients. Some patients might end up losing more bone because of the infections that were persistent during the presence of the natural teeth. Especially the challenging areas are in the upper jaw, the back region where you have sinus right above the molar teeth, and in the lower jaw you have a nerve that supplies to all the dentition, all the teeth. So that's a sensitive nerve wherein you have to take care when you plan for implant placement. Other most important aspect is preparation of the patient. Like some may have diabetes, some may have thyroid issues, some may have autoimmune conditions. So we need thoroughly take proper medical history, and then we need to plan or take up the case according to the presentation of their medical history, whether they are fit or not fit for the implant procedure. Now, this may not be applicable for all the individuals. Say for example, at the age of 25 to 30, 35 or 40, people may be healthy. Just routine blood investigations and then take up full mouth rehabilitation. But above the age of 35 to 40, we need to thoroughly evaluate one, if they have any medical history. Accordingly, we need to choose which case is ideal to do immediately, or some cases they may need some preparation pertaining to their medical history, and then we can prepare the case accordingly. If not now, maybe after 2 or 3 months we can plan to do for such kind of patients. Likewise, the bone. As I told you, nowadays it's very common that we get to see vitamin D deficiency. We need to evaluate the blood levels of vitamin D and also the porosity of the bone where we are going to place the implants, because that is going to determine the integrity, the strength of the implants which are going to fuse with the native bone. Now along with this, the implant components, implant designs, so all these play important role. If you have enough bone, you get to place 8 straight implants in the lower jaw, 8 straight implants in the upper jaw. But in the scenario where there is no adequate bone in the posterior maxilla or the upper jaw, where there is no adequate bone in the lower jaw posteriorly, so in such situations we have to utilize the bone in existence devoid of the areas where there is no bone. So commonly in the upper jaw, it is in between premolar to premolar, that is called as premaxilla. So premaxilla is the area wherein you have sufficient bone, even if the bone is lost behind. So in 80 to 90% of the cases. Now we utilize that bone, but it is only up to the premolar, but we have to give the posterior molar teeth as well. So which is why when we place the posterior implant, the one that is farthermost behind among the implants that we place in the premaxilla, it needs to be tilted in such a way that we can also give the molar teeth. So likewise, initially system or the technique of replacement of the teeth, that is a graftless solution, was termed as all-on-4 technique. So all-on-4 is a technique where you use the premaxilla in the upper jaw, in the premaxilla, wherein you have 2 tilted implants on either side and 2 straight implants in the anterior aspect. So taking support of the 4 implants, you replace 12 or 14 missing teeth based on the emergence of the posterior implant.